Hello and welcome everybody to the National Health Executive Podcast, brought to you by Cognitive Media Group, publishers of National Health Executive, the UK's leading platform for healthcare news, insight and thought leadership. I'm Roy Rowlands, and today we dive into the fascinating topic that sits right at the heart of modern healthcare delivery, which is the healthcare paradox. Now, for many of you, this paradox is something we're all becoming increasingly aware of: the growing demand for healthcare services on one side, and on the other, a system that's struggling with capacity, workforce, and resources to meet that very demand. It's a tension that presents not only significant challenges, but also huge opportunities for innovation and improvement across the sector. And I'm delighted to say that I'm joined by Fiona Garin McDonagh, Vice President of Strategic Marketing at BD Medical Pharmaceuticals, to discuss this very topic. So Fiona, welcome and thanks very much for joining me. How are you?
Very well, thank you. I'm delighted to be here today.
Before we jump into the detail then, can you explain to the viewers and start by sharing a bit about yourself, your background, and what's brought you to this position in your career?
Yeah, so again, I think one of the things that's very relevant is I grew up in a multicultural environment from an Irish mother, Basque father from the north of Spain. I grew up in Spain. I studied business studies, although I entered medical school at the age of 18, decided not to do that. Worked in strategic consulting and Pricewaterhouse at the time, started in London, then worked in Spain, and then actually decided to do graduate school in the US. So I did a double master's in foreign service as well as in public health. I joined the World Bank, where I actually did a lot of healthcare transformation. I think viewers in the UK will be happy to know that we did a study tour to visit the NHS. It was the jewel of the crown, not only within the context of the UK, but also at global level. So you had a lot of stakeholders actually viewing that to export the model of what was going on in the UK elsewhere. And then after a few years, I decided to join the industry, hence BD, which is one of the largest medical technology companies, because I realized to be able to solve for healthcare challenges, it will require a very solid public-private partnership. So no one actor across the healthcare ecosystem can actually solve things on their own. So I have been in industry for a while. It has its pros and its cons, obviously, but I do feel very optimistic that in years to come, the role of industry will become much more apparent, I think, to everyone who's working in healthcare today.
Yeah, I agree 100%. And what an interesting journey, the fact that you decided not to pursue the medical path, but yet this is exactly where you've ended up. Quite ironic.
Yeah, I'm absolutely passionate for healthcare, always have been. It's probably one of the few topics I can read and get exposed to for multiple hours before actually losing my concentration. So yeah, and I really am passionate about healthcare, particularly in Europe, because I think we've all been very, very privileged to have access to high quality care since we were born for many, many decades, having access to a universal coverage. And I'm very concerned that that may not be the case, I think, for current and future generations in the upcoming years because of the challenges at stake today.
Yeah, it really is a worry. I've got some friends that moved out to the States a couple of years ago now, and it was a shock to their system. They knew they'd have to pay for healthcare, and they knew it was more expensive, but you've got to plan significantly for that over there. They were explaining to me, and when you come from the UK and you've got the NHS, which is free at the point of delivery, you do take it for granted, and then when it's not there, it's a big comfort blanket pulled away from you. So yeah, it's like you, I feel very passionately about protecting it, and I feel very passionately about the fact that we got this brand that can share innovation and drive collaboration between the NHS, the healthcare sector, and with innovators like yourself, to try and realize and get us one step further to that end goal, which is maintaining this beautiful healthcare system we've got in this country. So on that, then let's get straight into the healthcare paradox. How would you define it, Fiona, and what does it really mean in practical terms?
So I think you defined it really well. So I think I'll have a challenge to try and actually strengthen what you said, but I'll try just to get a little bit more granular. So I think the healthcare paradox is something that is affecting healthcare systems, not only the UK, but other certainly healthcare systems in the developed world and certainly in the developing world. So what it's all about is really at the same time you're facing, as you actually said very well, you have unprecedented patient demand. So in the case of Europe and the UK in particular, what this means is you have aging demographics. So it is estimated that close to 30% of the population will be 65 and above, at least in 2050, close to or above 25% in 2030. With aging demographics, what happens is you also see a rise in chronic diseases. So you see huge incidences in cardiovascular disease, in diabetes, in cancer, in mental disease. And I think for people listening to this podcast, who may not be as close to healthcare, 70–80% of expenses in healthcare are actually attributed to chronic disease. So the expenses are directly aligned. The other thing with aging demographics, which is something in Europe that is so important, also in the UK, obviously, is that it's primarily public. So it's funded through taxation. So as you have the pyramid of aging reversing, you have less percentage of working population, therefore the pool is actually smaller. So you have less money, or you actually have to increase the per capita spending. Additionally, in terms of that, you have patients that are more empowered, that are actually demanding faster, more personalized care. So that actually, from a demand standpoint, it becomes pretty acute. From a capacity standpoint, one of the biggest issues is obviously right now staff shortages. So you have shortages across all specialties. You also have rampant burnout of that same staff. You have aging infrastructure. So the infrastructure that was set up many, many decades ago is not necessarily, is a little bit obsolete. And then what you have also is a decreasing hospital capacity. So there is a big push to take care outside of the hospital. But the problem is there still is a big demand in having hospital capacity for complex care. Yeah. So that increasing gap between what patients need and what the system can deliver is exactly what I would call the healthcare paradox.
Yeah, you talk about patients, and let's talk about what the healthcare paradox means for patients. We all believe we can self-diagnose on Google. That puts added strain, I think, because we see or read something online, and perhaps we make a GP appointment or present at A&E sooner than perhaps we would have done, because we're starting to worry, unnecessarily so. That puts the added strain on. Maybe we're ahead of the curve and we're identifying something and we're able to nip something in the bud quicker because of that. And it's which camp do you fall in? You've got an aging population, as you quite rightly point out, and that's going to put a fiscal pressure on the NHS, as there's less people paying tax and NI and putting back into the system. And of course, in this country, we've got a declining in birth rate as well, which is only gonna strengthen and increase that burden a little bit further down the line. So there's so many things at play, and it's not just about the people delivering healthcare, and it's not just about the supply chain that's wrapped around it. It's everything. It's ourselves being emotive, looking into our own conditions. Some people are living unhealthy than they've ever lived before, and they're presenting with chronic diseases. And other people, because of social media, because of the access that it has to information about healthy living, they're living healthier than before. So sometimes you feel like you're stuck in the crosshairs, and it must be difficult for medtech companies like you who are dealing with healthcare professionals at the delivering vital healthcare across the country, for you to be able to sit down with them and help them solve their challenges, but first of all, understand the challenges. So what does that look like for you and your organization when you're working with healthcare sector?
So again, from a healthcare paradox perspective, that obviously also impacts, the industry and medical technology companies, because obviously as healthcare utilization rates go down, so does basically the demand for our devices. But very importantly, also we see healthcare systems delaying their decisions, scrutinizing investments, and actually slowing the adoption of innovation into the system. So I think for us, it could mean many different things. It means primarily that we need to engage differently. I think in the past, I always say that innovation was a nice to have, right? So a lot of leading edge institutions, top-notch doctors who wanted to continue to be super reputable, to being pioneers in their field, used innovation to actually advance their careers. What you see now is that relevant innovation, again, it's not just innovation for innovation's sake, but innovation that truly matters, is going to continuously play a role in actually covering for many of those gaps that were highlighted in terms of the healthcare paradox. So it will no longer be a kind of a nice to have, but more of a nice have. And that actually will change the way industry engages with customers and with the healthcare system. It will mean increased collaboration, increased partnership when it comes to innovation. So what is that relevant innovation that is truly needed in terms of engaging from a commercial standpoint? So how do we actually have the right evidence that can help healthcare systems understand what is that relevant innovation? What is the relevant evidence to prove that innovation actually works in practice? Because many times you have innovation that looks right on paper, but then needs to be inserted into the systems. And right now, with the current staff shortages that exist in the system, healthcare systems cannot afford to take out or to interrupt care delivery or disrupt it in any way. It needs to have seamless integration. So really understanding how that technology can actually play a quick role in helping address those gaps will also mean we will have to take a more predominant role in training and education. So really help to cover those gaps. One thing I didn't mention before is there's an increasing and heavy reliance on expatriate workforce. So you see, and by the way, this is not just unique to the UK, it's basically across the board. There's a global war on talent right now. Yeah. So there's shortages across all of the countries in the world. And what that means is if you are bringing Filipino nurses into the NHS, they don't necessarily speak the same language the same way. They've not necessarily been trained the same way. So how do you actually get them up to speed in the shortest amount of time possible? How do you standardize and make sure there's less variability in clinical practice? Because that not only costs money, but it also actually produces errors, it produces infections, and all of that actually makes patients stay longer in hospital. So it has an impact on the backlog of procedures. So playing a big role with the healthcare systems and helping them to do more with less, I would say, is probably one of our biggest challenges right now. And then working together, because I think this is new to everyone, working together with all of the actors to make sure we're all on the same playing field.
Yeah. And I think skills in general, in every sector, in every country, is a really big problem, full stop. There doesn't seem to be enough people to do the jobs. We're across three vertical markets as a media business, the rail industry in the UK, public services, and healthcare. And the three sectors are not unique when it comes to talking about skills shortages. We're a media business, and we struggle to find the people with the right skills, the right experience to do the jobs that we want to do. It takes time to recruit these people, and then of course you do have challenges, and that might be recruiting someone and bringing them to work, from an international workplace. And as you quite rightly point out, there's language barriers, there's different ways of doing things. You've got the added expense of sponsorship and stuff like that, and training these people up. So, globally, what's the answer here?
No, and actually, I would add even more things that are more acute. So I don't know, again, how close you are to this, but approximately 40% of existing healthcare practitioners are nearing retirement. So they're over 55 years of age, meaning there will be that rotation in terms of skill set and profiles. One of the other issues is that new graduate students, like medical students, nursing, et cetera, are not staying. They don't have newer generations, and this is not just the case for healthcare, it's the case across the board. So the different generations, when you look at millennials, Gen Z, et cetera, they have different aspirations, they have different ways of working, they have different value sets. And this is no different when it comes to healthcare. So I think factoring that in and understanding, of course, that the current way of operating, where you have healthcare practitioners basically working long shifts way beyond their call of duty, covering, nurse-patient ratios, which are way beyond what they should be, which obviously have a huge impact on complications, on readmissions, on errors, which also cause, by the way, emotional distress in the healthcare practitioner, which is not great, and places a huge burden on the existing workforce that has even less morale, less satisfaction. That will no longer be accepted, I think, by future generations. It's not like, oh, it's always been like this. So again, I think one of the biggest answers will be to boost staff productivity. So not necessarily only throwing more people at the problem, but again, as I said before, looking at what role can technology play in, let's say, less value-added activities. There's a lot of time spent, in some cases up to 70% of time spent on administrative activities, routine tasks that add no value. So by basically automating those, by using technology to address those, you're already freeing up time for healthcare practitioners with patients. So that's one area. The other thing, it will be to rethink how healthcare is delivered completely. So I think the model we have right now comes from Bismarck. So it's a Bismarck healthcare model. It was obviously centered around acute care hospitals. As we look at the future of healthcare, it should be really centered around how do you better manage chronic disease. And again, when this was set up, there was still a transition between, epidemiological transition between infectious diseases and chronic diseases. Right now, chronic diseases, as I said before, are rampant and exist across the board. 65-year-olds and above have at least 2 chronic diseases each. On average, at least 80% of the population has that. So we will need to rethink the way healthcare is delivered. That's why there's a big drive, and you can see that also in the new government in the UK, their drive towards digital, their drive towards care beyond the hospital. That's not just haphazardous. That is also a way to try and address many of the gaps that are existing. The biggest challenge is, how do you keep the plane flying and at the same time try and fix it, right? And that's what is very challenging, because healthcare is also a very highly politically sensitive topic. So what you actually see is that you have a lot of people feel very proud of their healthcare systems and actually really care a lot about their healthcare system. So that means that a lot of people who are actually making decisions in healthcare today are potentially thinking about the short term as opposed to the long term. They're also thinking about their little neck of the woods. So if you're working in procurement, your task or your objective is to reduce the price of devices and to bring savings to the institution. Whereas potentially it may make more sense to invest more upfront and to have a bigger return on investment across the board, because the benefits are not necessarily enjoyed by you. We're having to pay more. So I think in that sense, that short-term versus long-term thinking will have to be calibrated. I think, though, I mean, right now, we cannot afford to linger too much longer on the topic. There need to be concrete actions that need to be put in place. They need to be, I think, specific and localized, because there are different drivers, there are different population profiles, different needs of the population that need to be factored in as you're putting in place. So you cannot just, it's not one size fits all. Yet I do think that it's something that needs to be thought through sooner rather than later. And the other third element that I think will be very important in this equation is partnership. So it's no longer, let's say, relying on just one actor in the system to accomplish all of the challenges. You'll need to have academic institutions, you'll have to have industry, you'll have to have NGOs, you'll have to have a private plus public sector, healthcare, everyone coming together with the same objective, which is to preserve that sustainability for future generations.
Yeah, yeah. I mean, again, just so much to unpack. You talk about, different communities, localized healthcare, localized planning and delivery, and for me, I think a big part of the problem is government. Certainly in this country, you go each government comes in to Parliament, into power, with the NHS as a big part of its manifesto. We're going to, reset the NHS. We're going to give it some new vigor. And there's a top-down reshuffle. And, Labour under the Blair government did the same thing. Then the Conservatives and Lib Dem coalition did the same thing with another reset, and we bring in CCGs, and we're reshuffling all of the time. We're making GPs work with localized providers, with social care, with local authorities, as well as with the hospitals and trusts. And it's all great because it all sounds as though it's moving in the direction and we've got a clear plan. But then the plan doesn't work and it gets shifted again really quickly because we have a cabinet reshuffle, or we come to the end of the 5-year period and a new government comes in and they've got a new plan as part of their manifesto. As a technology provider who's looking for consistency and looking to partner and help solve real challenges, what do you think we need as a firm plan in terms of the management of the healthcare system in this country, so that we've got stability, we've got longevity, and we can plan 10 to 15 years in from now?
So I mean, to be very honest, I don't think we need anything much different than what is today on paper. And again, this is not unique to the UK. So if I had to summarize this, and you caught me off guard, I would summarize: you need leadership, you need courage, and you need to have the right incentives in place. Because again, people talk about care beyond the hospital. And again, this is not unique to the UK. But if the incentive system, if the funding allocation continues to be, heavily focused on acute, this is going to be very difficult for you to actually bring care outside of the hospital. If you don't have the right capabilities, if the incentive systems for doctors are to continue operating within the walls of hospitals, why on earth would they actually choose to go work for home care? Or why would they choose to do something different? So I think, again, as I said before, the problem is that everything is pretty short-term focused, and I wouldn't blame anyone, because again, whilst you're thinking about all of this and having to implement all of this, you have very ill patients knocking on the walls and doors of emergency rooms, in strained intensive care units, and you're just thinking about the here and now, because you're wanting to make sure, and that's the beauty of healthcare practitioners. They're the core of what drives them is really the patient. So they don't have much more time to deliberate around how do I change my workflow? How do I change my process? How do I get organized in a different way? Because that's what really will be required. So if it were me, I would actually have potentially a different parallel avenue of people thinking about not only what needs to be done, but actually how to actually accomplish it, operationalize it in very simple steps. So cutting the big elephant into pieces and actually just showing success little by little, but at least not thinking that you're going to transform healthcare from one day to the other, because that's not going to be possible. Because as I said, unfortunately for all of us, there's still many people that suffer from different illnesses, and we can't just afford to say, oh, park them. Sorry, can you wait a second until we get our act together and we start implementing some levers of our healthcare transformation? So I think, yeah, it's like how do you actually establish that short term, long term, and how do you get much more proactive and deliberate around how to implement what needs to be done, as opposed to, again, negotiating. And I think what you described before, which again is very similar to every country probably in the world, so I don't think the UK is different, is like people negotiate different plans and they say, what do we need to get done? And maybe we embellish it differently this time around so that it seems like it's something different. When I think we've been talking about care beyond the hospital across Europe for many, many different years. So it's like, instead of saying care beyond the hospital, okay, what are the biggest barriers to doing that? And then how do we actually put a plan in place that may not be for 1 year, but maybe for the next 5 to 10 years? And how do I ensure that the right incentive structure is in place so that people who may not reap the benefits of actually driving that strategy are still going to be enticed to actually facilitate it happening?
Yeah, I couldn't agree more. So when we look at them, it brings us back to this delivery. Everybody's got a job in hand, and that is to make patients feel comfortable, to make them feel better, and hopefully, keep them alive and save lives. And it's one of the most important jobs I think you could ever wish to do and have on your agenda. So what does good look like then for you as an organization when you're brought in to work with these healthcare providers? What have been the highs for you, and where have you seen things really add value, and how have you worked with these organizations to help them drive adoption? Because you mentioned before about flying the plane. You've got to fly the plane, but you've also got to use this new system, and this new system is going to save you time a little bit further down the line, which is going to give you time back to help save more people. But it's a chicken and an egg situation. So how do you as an organization solve that conundrum for your partners, your clients?
So I think our biggest highs are always when we get good feedback that is directly related to patient outcomes, obviously. So how have our technologies enabled healthcare practitioners to drive better clinical outcomes? I think we're very vested. I will always talk about the sustainability of healthcare. We're now very focused on 3 key areas. Why? Because they represent the highest burden of disease and cost. And these 3 areas are all about the patient safety. And in our case, this has really represented 4 key areas. So how do we partner with institutions to help prevent, treat, reduce healthcare acquired infections? So I think many years ago, I think in the UK, every Tom, Dick, and Harry, as they say, knew about MRSA because it was on the newspapers every day. So really about infections, so surgical site infections, catheter-related bloodstream infections, catheter-associated, urinary tract infections. So all types of infections, because right now, 1 in 15 patients when entering a hospital actually catch an infection. It's more dangerous to enter a hospital right now than actually to do bungee jumping. So
Yeah.
that's definitely one of the areas. We're also very vested in medication errors. Again, it's estimated between 3 to 14% or 2 to 14% of patients entering a hospital as well actually can acquire a medication error, and that has many repercussions. In both cases, that means that the patient obviously has to stay longer in the hospital, so it's not good for the patient experience, and it's certainly not good for the healthcare institution funding or for their beds because of the current backlog of procedures. I think the latest statistic I saw in the UK was that over 7.4 million people were actually waiting for treatment in the UK. So again, for every patient that has to stay longer in hospital, that means that patient on that waiting list actually has to wait longer. We've also worked a lot on antimicrobial stewardship, which really is all about how do you ensure the rational consumption of antibiotics that has an impact on resistance. Many people say that the next pandemic will be antimicrobial resistance. So 10 million people will suffer from it and die from it in 2050. And for any layman, that is very interesting. So you have a sore throat, you have a bacterial infection, suddenly that doesn't work, and that you could end up dying from something as simple as that. The second pillar we're partnering a lot on, and we feel proud is really partnering around, for me, the cornerstone of the future of healthcare, which is really staff. We've talked a lot about staff, but we've talked about staff shortages, staff retention, staff satisfaction, staff well-being. We conducted a study over a year ago with over 500 healthcare practitioners in the region that really looked at how the role of technology could actually help retain staff in institutions, because they recognize the role it could play to make their life easier, to really support them and empower them to do the right thing at the point of care. And the third area, which is very, very important, is all around efficiencies. The issue with healthcare is that it's estimated, OECD estimates that approximately 20% of healthcare is wasteful. So it could be actually put to another thing. So in the end, and that is because of administrative burden, it's because a lot of things that could be basically automated, wrong decisions when you get 20 tests instead of one, when you use 3 catheters because you've not gotten it right the first time. So, and in that end is, how do you identify that waste in the system, and how do you reduce those hidden inefficiencies so that you can actually put it to better use. And we do have many different examples in which we have partnered with different institutions through technology. Technology is not just technology on its own. It's actually collaborating with customers on saying, how do you redefine workflows? How do you redefine processes, procedures in order for that technology to really maximize the outcome? Technology on its own is never going to do the trick. You need to really collaborate and partner, and healthcare practitioners need to understand why it's being implemented and how it's going to actually enable them. It's not substituting them, it's just empowering them, as I said, to actually do the right thing. And as I said, what we do is around those 3 pillars, which again represent the biggest burden of disease and cost. We collaborate with different institutions to ensure we understand where their biggest pain point and need is, because the inefficiencies actually have a huge financial sustainability impact. And you will see that a lot of healthcare systems are either going bankrupt or basically have big issues to meet their budgets. And that's one of the biggest excuses also. It's kind of a catch-22 to be able to incorporate or adopt innovation. So in this sense, this allows that collaboration. We have like value calculators that help them understand what could be the impact of the technology in helping them address their pains, and then really supporting them end to end in that implementation. So how do you actually ensure that that technology delivers what it's meant to deliver, so that it is fully embedded in a seamless way, again, so that you're not disrupting care, in a seamless way in daily practice.
Yeah, and I think that brings us nicely to a conclusion there, where we all need help everybody needs a leg up, and it's clear that if you can lean into that support and that help, in this case with technology providers like yourself, who can take a step back, look at the challenges, look at the problems, and present workable solutions where these case studies and best practices already in place, and some of the highs that you highlighted before, it really does free up that time for healthcare professionals to think about the patient more, think about the care that they're giving, and reduce some of these pressures on the healthcare system long term. And I think it's the age-old problem, isn't it? We don't make the time today to do the things that are going to help us in the future. And I think what I get from talking to suppliers across various different sectors that we're operational is that when an organization leans into a supplier and works openly, transparently, and collaboratively with you, incredible things get done because you're a specialist in your sphere and you know how to help solve some of these problems. And in healthcare, they're specialists in healing and curing people and making them feel better. So, why wouldn't you lean into that?
Yeah, and I think what's important is that this is new to almost anyone. Although I can tell you again, similar to the care beyond the hospital, there's value-based healthcare has been talked about for a long, long time. The problem is on paper, similar to government policies, it's been on the books for many years. The problem is how do you actually operationalize it in practice with current systems and structures, and how do you again have the right incentives in place so that people are inclined to want to move in that direction. I don't think anyone has the right answers and every single answer to every potential gap or question. I only think that if you only have partial information, it's going to be very difficult for you to solve for the full problem. Whereas if you collaborate across the ecosystem and you have all actors rowing in the same direction, it's much easier to keep the problem that you're trying to solve for at the center of everyone's agenda so that everyone actually does their part in actually solving that. And by the end of, let's say, the journey, you can be ensured that the problem is actually solved for, as opposed to right now, where everyone's just trying to, let's say, not drown and kind of breathe up into the surface, right?
Yeah, I think we all need to um, be able to take a step back, look at what we've achieved, and feel really proud of what we've done, and what the future holds. And I think that motivates people, and it gives us a real sense of agency and satisfaction.
Yeah, to be very honest, I think that's one of the things, well, certainly is what keeps me up. It's what really drives me to stay where I am. And I would say it's what really creates a sense of belonging in my organization right now, is to have the ability. There are not that many jobs where you actually have the opportunity to shape the healthcare system in which anyone you know will actually end up there. It's either your parents or your siblings or your friends or your neighbors or your colleagues at work. And as I say, when I actually enter a hospital, I would like to wait as little as possible, get the best care as possible, have the best attention as possible. So the fact that you can do your part to ensure that that actually happens is very rewarding. And it really actually, I think it's the same case across, I would say, everyone who works in healthcare, because despite many of the frustrations that exist, as you said, we all should feel so proud. And I go back to the comment your friend made. I also lived in the US, and I can tell you the first month I was there, it was really healthcare that enabled me to truly understand the difference between Europe and the US. Before leaving, I felt Spanish. I did not understand what the cohesion was across Spanish, Italian, German. And it was one question that actually made me reflect on the big difference. And it was, is healthcare a privilege or is it a right? And I can tell you, for the most part in the US, it's a privilege.
Yeah,
Here it's a
definitely.
right. So how do we all continue working daily to ensure it continues to be a right for all of the future generations that are coming. Again, aligning it to the healthcare paradox that we were discussing at the beginning of the session.
Yeah, definitely. Well, I think that's a great place to end, Fiona. I've really enjoyed the conversation. Been really interested, and your passion has clearly come across. You know, you're very knowledgeable about the challenges, and you draw some really interesting comparisons, and you make us feel as though, you know, we're not alone in this country with our healthcare system, and it's good to know that, you know, globally we've all got the same challenges, but we've also then got the same opportunities, haven't we?
Exactly. That's exactly the glass half full or half empty. And we should actually remain with the glass half full.